I'm Danita Mason Hogans. I am an organizer, a local historian, an oral historian, and most importantly, a mother.
I'm Wesley Hogan. I am a friend of Danita. I'm so happy to be here with everybody this morning. I'm an oral historian as well, and Danita and I have been working with the Snake Legacy Project the last decade plus to help to foster SNCC people telling stories, their own stories on their own terms, and making sure that those stories are in the historical record.
So, what we've learned to do is to take some of the things that we've learned over these years and transfer them to local local policymakers, local people in the community, and that work has been parallel with the ways in which we've learned to deal with each other. You know, the generation of the SNCC folks and the generation of the women in the movement and people who we have worked with is kind of unique because this is the generation that has lived through Jim Crow, but also resisted Jim Crow. This is the generation who really are about a generation or two removed from enslavement. So what Wes and I have been doing is to try to develop a methodology to really interrogate what learning is and what scholarship is, and to learn from the folks who have actually lived through this history and try to figure out ways that we can extract some of the things that they have learned, not just what happened, but why it happened and what were some of the strategies to combat the position that folks were in. And so we have really been focusing on the way that we ask questions and the way that we develop relationships with folks, not as a way of some mystical understanding of how people got through, but really pragmatic examples of strategies and situations and methods of care and community that people have developed over the time that they have spent with each other.
So, Dee, can you tell a little bit about the Women of the Movement group and how you came to work with them, and then why we began to focus on Black women's reproductive health?
You know, the women of the movement are women who were involved with the civil rights movement in Chapel Hill. And I
Mm.
know in my own activism, it has been women who have been strategizers, organizers, and have pulled folks together. And I know in my personal walk, that I try to be a mentor to some of the young people. But the women, the civil rights movement is kind of a nuanced understanding of how the civil rights movement unfolded and the position that women played in the civil rights movement, I find has been regulated oftentimes to helpers as opposed to strategists and people that we could really learn from. And so we were exploring our local civil rights movement in Chapel Hill and decided to focus on women who broke barriers in the medical field, in the activist field, and also in the education field. So the women of the movement are a collective of women in their 80s, some 70s, and some 90s who have been active participants in the social justice movement. And we have been meeting now for almost 10 years to discover strategies, ways of building community, and ways of care from these women.
And I'm just going to say you have a podcast, you have a YouTube series, you've done an exhibition in the local library. You guys have all kinds of ways that you've been sharing these strategies and histories with the wider community. And so then when Roe v. Wade was overturned, my neighbor started asking me, hey, can you come tell the stories of providers, reproductive care providers, and what they're facing in this post-Roe period? And in the process of that, I learned that one of the very first young women to die was somebody in South Carolina, a young Black woman who had had a healthy baby and hemorrhaged, like many women do with the first birth. And when she uh, was getting ready, the doctor was getting ready to wheel her into the OR to do a very quick procedure, which would have easily saved her life. The OR administrator said, nope, you can't do that process anymore because Dobbs has made, Roe has been overturned, and the procedure is called a DNC, and that's the same name as a first trimester abortion. And so you can't do it. And so this young woman dies. Her baby is healthy in the warmer. It was not an abortion. And so I was like, we need to figure out what's happening here. This looks so similar to so many other previous incidents of racist OBGYN care. And so you invited me into the Women of the Movement, and we started thinking together about how we might use this SNCC model of accountability. How do we stay accountable to the women of the movement to make reproductive care better? And then I'm going to throw it back to you because when we began to talk about this, you paved the way very carefully for me to come in and share the work.
Yeah, what I think a natural evolution of a conversation about civil rights when you're talking with Black women leads to reproductive care in some form or another, particularly when Black women in North Carolina, I call, were the vanguards of the desegregation movement because before the schools were integrated, the hospitals were places here which allow Black women to become nurses, and immediately they had to advocate for Black care because we saw these discrepancies very early. So it was a natural conversation when we started talking about health care to also go into the care people received when they were giving birth. And a lot of these stories were strikingly similar, and they were also generational. I had very difficult time when I was giving birth to my children 25 years ago, and my mother had difficulties when she was giving birth to me, and her mother had difficulties. And there were also some really good practices of care that I thought about when the women would talk about how women would come from all over the community to make sure that the woman was comfortable, and how that translated to people needing to have advocates there in the hospital. And so the exploration about how people comforted each other and also were there for each other and in community with each other
Mm.
became really important to dive into a little deeper, and how that advocacy was hand in hand. So when you approached us with this idea, I thought that it was really, really important to develop that relationship, which is the most important thing, to develop relationships of trust that have been so fractured along this period of time. And for these women to share with you, somebody that they do trust, these experiences that they have had, not only of trauma, but also of resilience and some of the things that they have learned to care for each other that are very prescriptive and very offer the best practices, the medical practices that we're missing today.
Yeah, I mean, I think one of the things that was striking to me is that we have a ton, just like libraries full of research about health disparities. So we know that there are problems that are massive, right? So we know these statistics about four times um, Black women die at four times the rate of white women in childbirth in that, and then in that first year after the baby is born, they're just completely unacceptable, huge crisis. And yet, all of the interventions that we've seen people try are only doctor and hospital based. We haven't figured out a way to make sure that the women in these local communities that carry this profound intergenerational knowledge are a part of that problem solving team at the table the same way, at the same level of power. And so I think what we're trying to do now and what we're going to share with you a little bit of our thinking with, we'd love to think with you guys as well, if you want to share with Anne and others how you can imagine going forward. But we wanted to bring uh, this doctor who I've been working with on the abortion care project. She's the trainer, she's the head of residency at Duke, and she's really good friends with the head of residency at UNC. And these two white women that were like, well, we want to fix it, but we have no idea how. And you and I were like, well, why don't we try to figure out a way where we can bring those two teachers to the table with the women of the movement at an equal plane and set up some accountability mechanism that's similar to the one we set up with the SNCC folks when we were trying to make sure we got the SNCC folks' history in the archive the way they wanted. So the idea is let's make sure we bring residents, young doctors who are becoming OBGYNs, to the feet of these elders and the women of the movement and teach them how to listen.
The problem then is the same problem now. Black women are not listened to. And the
Mhm.
value of the knowledge base that Black women have produced and maintained and sustained us is really devalued. So there has to be, in my view, some sort of parity between what we think we value as content knowledge, as opposed to opening up our minds to be more expansive in terms of what we know. There are prescriptive care practices that we can learn from Black women. So I think that accountability model is really important because it kind of gives us a way to interrogate what we consider real information that is important to the sustainability of Black lives, as opposed to what we've been conditioned to think is important medical care. And so, if we can bridge those two together, I think what we potentially find is that missing piece of medical care that has not been afforded to Black women all of this time. So, at the corner of that is that power
Mhm.
balance of accountability.
I think it is important that we share our experiences and observations about what we had to undergo, because it might be one or two of them that will listen to us and really try to make a difference. Some, I think, it's not going to matter because they're already coming in with preconceived ideas. And I think it's imperative that they recognize that they do have these biases and try to work on them for the benefit, um, for the good of the patient. I think, like I said, I think the experiences that we had, and most of the time they've not been pleasant. So if we go in explaining how we felt, and what it means to be discriminated against, what it means, even if you really weren't, what it means to anticipate that there are going to be problems with maybe the doctor simply because we are Black.